alaikum everyone. Hope you all are doing well. Myself Shani Halima and I am a student of BS Biotechnology. My topic for the presentation is ginseng. What is ginseng? Ginseng is a root of phoenix plant. Ginseng is a plant that has been used in medicine for centuries. Basically, ginseng is a herb that Koreans use for their stress releasing energy and supporting a healthy body. Ginseng has been used in medicine for centuries, but modern clinical studies are inclusive about its medical beneficence. Although ginseng is sold as dietary supplement, a manufacturing conflict with pharmaceutical has led to review of some ginseng products that may be toxic or contaminated with inappropriate chemicals, such as using too much to cause adverse effect or interfere with medication. History History of ginseng is that it is manufactured in China and Korea. This herb is not used as a cure-all medicine. It is used as supplement, especially for patients and recovering patients. Ginseng species. Ginseng plant belongs to Penis genus. Cultivated varieties include Penis ginseng, Korean ginseng, Penis notoginseng, South China ginseng. Ginseng grow in cold climates like Korea, Northeast China, Russian, Canada, and US. But some varieties grown in warm region. Wild and cultivated ginseng. Wild ginseng. Wild ginseng grow naturally in mountains. The wild ginseng plant is most extinct in China and endangered globally. This is due to high demand for the product in recent years. Here is the structure of wild Korean ginseng and wild American ginseng. Cultivated ginseng. Cultivated ginseng is less expensive than the rare available wild ginseng. Cultivated ginseng is planted on mountain by human and is allowed to grow like wild ginseng. Here is the cultivated Korean ginseng and cultivated American ginseng. The difference between wild ginseng and cultivated ginseng. Origin and growth. Wild ginseng found in natural habitat, often in dense forests of North America, Asia and part of Europe. Cultivated ginseng grown under controlled conditions. It grows faster than wild ginseng. Appearance. Wild ginseng, irregular twisted roots that can be assembled the human figure. Cultivated ginseng, more uniform in shape and size, make it easier to process. Flavor profile. Wild ginseng is subtle bitterness and cultivated ginseng is less bitter and more palatable for some individuals. Price and rarity. Wild ginseng considerably more expensive due to sustainability harvesting efforts. Cultivated ginseng more affordable and widely available one. Sustainability. Wild ginseng harvesting can harm natural habitats, leading to legal restriction and conservation efforts. Cultivated ginseng. Cultivation method can be more sustainable, reducing ecological impact. 1. Ginseng processing. Ginseng seed normally does not germinate until the second spring following the harvest of berries in autumn. They must first be subjected to the long period of storage in a moist medium with a warm cold treatment, a process known as stratification. Chemical structure of ginseng. The basic structure of ginseng saponin comprises a hydrophobic steroidal 4-ring system with a trans relationship and diverse carbohydrate glucose, ramenose, hexulose, arabinose attached to the carbon 3, carbon 6 and carbon 20 position. Each ginseng saponin can further classified as belonging to the dominant type include the panoxyl type which contain a hydrogen atom, the panoxyl type group which contain a C6 sugar chain and the oleanine type which has two minor classes, the oleanonic acid group and acetol group based on their chemical structure. Here is the chemical structure where it is starting from OR1 and end at OR3. However, due to the hydrophilicity, ginsenocytes can be observed in small intestine after oral transmission, but they are not easily observed from the intestine due to their poor water quality. Studies have shown that intestinal bacteria degrade saponin into secondary glycosides through the hydrolysis of glycosides bond and determine the effective drugs by controlling their oral administration. All metabolites such as compound K, which is non-polar compared to the parent component and are observed in the intestine and exert biological effects. Here are the structures from which ginseng has been prepared. Fresh ginseng. Fresh ginseng, also called green ginseng, is non-dried raw product. It is used in limited bioavailability. Here is the structure of fresh ginseng. White ginseng. White ginseng is peeled and dried ginseng. White ginseng is fresh ginseng which has been dried without being heating. It is peeled and dried to reduce the water content to 12% or less. Dried in the sun bleaches the root to the yellowish white color. Red ginseng. Red ginseng is steamed and dried ginseng which has reddish color. Red ginseng is less vulnerable to decay with the white ginseng. It is ginseng that has been peeled, heated through steaming at standard boiling temperature of 100 degrees Celsius, and then dried or sun dried. It is frequently marinated in a herbal brew which result in the root becoming extremely brittle. Production of red ginseng. Commercially, ginseng is sold more than 35 countries, with the largest consumer being China. In 2013, global ginseng sale exceeded US $2 billion, half of which was produced in South Korea. At the beginning of 21st century, 99% of the world 80,000 of the ginseng was produced in four countries: China, South Korea, Canada, and United States. All ginseng produced in Korea is Korean ginseng, while the main ginseng produced in Canada and the United States is American ginseng. Uses: ginseng may be included in energy drinks or herbal teas in small amount or sold as dietary supplements. Food or beverage. The root is most often available in dried form, either whole or sliced. In Korean, ginseng is used in various benches and group as well as tea and alcoholic beverage. Ginseng leaves are used for the prepare food and beverage. Leaves are used to prepare Asian soup steamed with chicken or combined with ginger, dates and pork or eaten fresh. Here is the dishes. Traditional medicine and phytochemicals. Although ginseng has been used in medicine for centuries, modern studies have proven that ginseng has any biological effect. Clinical studies show no evidence of an effect on memory, fatigue, menopausal symptoms, and insulin response in patients with diabetes. A 2021 review found ginseng had minimal effect of erectile function or sexual satisfaction. As of 2023, there is not enough evidence that taking ginseng improve health or reduce the risk of any disease. While roots used in traditional Chinese medicine, leaves and stem contain more phytochemicals than root are easier to harvest. These components include steroid, but as of the 2021, the effect of these ginseng compound has not been subjected to good clinical studies and are therefore still unknown. Benefits of ginseng. It's rich in antioxidant and contains two significant compounds, ginsenosides and gintonin. Reduce inflammation. Ginseng has antioxidant and anti-inflammatory properties. Studies suggest that it can inhibit inflammation and reduce oxidative damage to cells. Benefits: brain function. Components in ginseng such as ginsenosides may protect the brain against damage caused by the free radicals. Improve erectile dysfunction. Some research indicate that ginseng may help with erectile dysfunction. Boost immunity. Ginseng has immune enhancing effect and may help protective against infection. Protects against cancer. Although more research is needed, ginseng shows promise in reducing cancer risk. Fights fatigue. Ginseng has been traditionally used to combat fatigue and restore vitality. Lower blood sugar. Some studies suggest that ginseng may help regulate blood sugar level. Remember that there are different types of ginseng such as American ginseng and Asian ginseng, which vary in their different effects on the body. If you are considering using ginseng, consult with a healthcare professional to determine the right type and dose for your needs. Safety and side effects. Basically, it enhances the energy level, lowering oxidative damages. It increases energy level production in cells, improve brain functions like memory, behaviors and moods. It is beneficial for mental functions, feeling of calmness and mood in both healthy person and those with disease. Side effects. Research showed that ginseng appear to be safe and should not produce any serious adverse effect. But few side effects are headache, sleep problem, digestive problem, change to blood pressure, blood sugar and diarrhea. The long-term use of ginseng may result in nervousness, anxiety, confusion, depression or feeling nausea, and as well as other effects are breast pain and vaginal bleeding. Overdose. The common ginseng are generally considered to be relatively safe even in large amount. One of the most common and characteristic symptom of an acute overdose of pea ginseng is bleeding. Symptom of mild overdose may include dry mouth, lips, as well as increased body temperature, increased blood pressure, and morning diarrhea, bleeding and fatigue. Symptom of self-overdose with pea ginseng may include nausea, vomiting, restlessness, urinary and fever, include blood pressure, increasing respiration, and as well as red facial complexion. Here is the references from where I made my presentation, and that's it. Allah Hafiz.